Welcome back. In this video, we'll talk about the symptoms of lupus erythematosus. SLE, or systemic lupus erythematosus, is a systemic condition that involves the autoimmunity. In other words, the body produces antibodies that attacks oneself. These defective antibodies cause random inflammations throughout the body. In the skin, for example, it is common that these patients have random rash attacks, especially in the face. This rash can include both of the cheeks and the nasal bridge, forming a shape that resembles a butterfly, and this is known as Malar Rash of lupus. Lupus can also cause hair loss by attacking the hair follicles themselves, and so the hair loss will be caused by a hair falling from its roots. This can either be systemic, involving the entire body, or localized to a specific area. The chronic state of inflammation can also affect the patient's weight, although most of the weight status is affected by the medications that treat the lupus, not the lupus itself. But weight loss is common in lupus patients. The chronic state of illness, along with the autoimmunity, can create a state of anemia in the blood, and this can be seen as low blood count or defective RBCs. The patients can also develop blood clots, which we see as venous thrombosis or pulmonary embolisms, occasionally as strokes as well. Keep in mind, if a lupus patient is suspected of having multiple strokes or multiple clots in the body, they should be screened to have antiphospholipid syndrome. Arthritis is also a very common complaint of lupus patients, and this presents as stiffness or pain in the joints. Kidney involvement is also very common, and this is often life-threatening and acute problem. The heart and lungs can also be involved, especially the layers that covers the heart that are known as the pericardium, and this can be inflamed, known as pericarditis. The heart and the lungs themselves can also be affected, although it's not as common as the pleura of the heart or pleura of the lungs. And finally, the brain involvement is also seen in lupus patients, although fortunately it's not very common. And here's a small quiz. Which of the following autoantibodies is seen in lupus erythematosus patients? And the answer is A and A, anti-nuclear antibodies.